HIV/AIDS is a major global health issue. It has affected millions of people worldwide. This serious condition attacks the body's immune system, making it hard to fight off infections. HIV stands for Human Immunodeficiency Virus, and AIDS stands for Acquired Immunodeficiency Syndrome. Understanding HIV/AIDS is the first step in fighting this epidemic. We need to increase awareness and support those affected. Let's break down the stigma surrounding HIV/AIDS. We can work together to make a difference. HIV is a type of virus called a retrovirus. It attacks the body's immune system, specifically the CD4 cells, which are white blood cells that help fight off infection. When HIV infects a CD4 cell, it takes over the cell's machinery and uses it to make copies of itself. Over time, HIV destroys more and more CD4 cells, weakening the immune system. This makes the body vulnerable to opportunistic infections, which are infections that wouldn't normally cause illness in a healthy person. Without treatment, HIV can progress to AIDS, the most advanced stage of HIV infection. At this stage, the immune system is severely damaged, leaving the body highly susceptible to life-threatening infections and cancers. HIV is transmitted through certain bodily fluids including blood, semen, vaginal fluids, and breast milk. It can enter the body through cuts or sores in the skin, as well as through mucous membranes, which are the thin, moist tissues that line the inside of the mouth, nose, rectum, and vagina. The most common ways HIV is transmitted are through unprotected sex with an infected person and sharing needles or syringes with an infected person. It can also be transmitted from mother to child during pregnancy, childbirth, or breastfeeding. There are many myths and misconceptions about how HIV is transmitted. It's important to separate fact from fiction. HIV cannot be spread through casual contact, such as hugging, kissing, shaking hands, or sharing utensils. It also cannot be transmitted through air, water, insects, or toilet seats. These myths can lead to fear, discrimination, and stigma, which can prevent people from getting tested and seeking treatment. By understanding the facts about HIV transmission, we can help to reduce the spread of the virus and support those who are living with it. Section 5. Global HIV/AIDS Hotspots, where the burden lies. While HIV/AIDS is a global issue, certain regions and countries are, disproportionately affected. Sub-Saharan Africa remains the most affected region, accounting for a significant proportion of new infections and AIDS-related deaths worldwide. Other regions with high HIV/AIDS prevalence include Eastern Europe and Central Asia, particularly among people who inject drugs. In Asia and the Pacific, HIV transmission is often concentrated among key populations, such as men who have sex with men and transgender women. Addressing the HIV/AIDS epidemic requires targeted interventions and support for these heavily impacted regions and populations. Section 6. Prevention is key, protecting yourself and others. Preventing HIV infection is crucial to ending the global epidemic. There are several effective methods of prevention, including abstinence. Abstaining from sexual activity is the most effective way to prevent HIV transmission. Using condoms consistently and correctly during sexual activity can significantly reduce the risk of HIV transmission. PrEP, or pre-exposure prophylaxis, is a daily medication that can prevent HIV infection in people who are at high risk. PEP, or post-exposure prophylaxis, is a medication that can prevent HIV infection after a possible exposure. It must be taken within 72 hours of exposure. For people who inject drugs, using sterile needles and syringes and participating in needle exchange programs can reduce the risk of HIV transmission. Section 7. Treatment as prevention. Living with HIV. With early diagnosis and treatment, people with HIV can live long and healthy lives. Antiretroviral therapy, or ART, is a life-saving treatment that suppresses the virus, preventing it from damaging the immune system. ART also significantly reduces the risk of transmitting HIV to others. When taken consistently as prescribed, ART can lower the viral load in the blood to undetectable levels, meaning that the virus is effectively suppressed and cannot be transmitted sexually. Section 8. The importance of testing and early intervention. Knowing your HIV status is crucial for both prevention and treatment. Getting tested for HIV is quick, easy, and confidential. Testing is particularly important for individuals who may have been exposed to the virus, Early diagnosis allows for timely initiation of RT, which can significantly improve health outcomes and reduce the risk of transmission. Regular testing and early intervention are essential components of a comprehensive HIV/AIDS response. Section 9, A Future with Hope, Striving for an AIDS-Free Generation. While the fight against HIV/AIDS is far from over, there is hope for the future. Advances in prevention, testing, and treatment have brought us closer to an AIDS-free generation. By continuing to raise awareness, reduce stigma, increase access to testing and treatment, and support research efforts, we can work towards a world without AIDS. The global community must remain committed to addressing this health crisis and ensuring that all people living with HIV have access to the care and support they need.